Morning. You're allowed to talk to me today. Right to start, Britt?
Yeah, all good to start. We might have a few latecomers, but I'll just let them in as they arrive.
Sure. All right. So good morning, everybody, and welcome to part 3 of our anxiety series. I am hoping that today that we do a little bit of work around, just a couple of case studies and some question Q&A kind of time, as well as learning about different services. Hang on, there we go. All right. And we will definitely, I'll definitely have dedicated some time to talking about what services are around. And I've sent some resource sheets out with different organisations around the place, a lot of 24-hour ones that you might be able to give to your clients, who need them. So again, just acknowledging importantly the traditional owners of the land that I'm teaching on today, the Gunai-Kurnai people, and paying my respects to both elders, both past, present and emerging. All right, so part 3. So we've already gone through what is anxiety. We've talked about anxiety, talked about the symptoms of anxiety. Hopefully you've got the slides, if you wanted any prompting when you're thinking about the scenarios. You've got the slides there. I would ask too, if you haven't printed out the scenarios, could you do it from your desk now? Because you're going to go into rooms together, so that you'll need to be able to read the scenario to be able to come up with some of the strategies. So remember we talked about all the different types of anxiety. We looked at signs and symptoms. There's so many of them, and we know that everybody's different. So some may experience more different symptoms. Then we talked about how it can impact in the workplace, which I'm sure that a lot of you have actually already had exposure to, and found yourselves having to support someone who's not doing too well at work. And just some strategies, when trying to consider, when considering job placement and some of the things. And I would like to just address the question I got earlier. I think it was Tanya. I haven't printed the question off, but Tanya did ask about disclosing of someone's condition to the employer prior to employment. And this was a situation where there was a lady who had very severe menstrual problems once a month, and this usually meant that she needed to take some time off, and because she got quite unwell with it. So my answer to that, and I'm very happy for anybody else to unmute and actually offer the, because you guys have, you're in this or this sort of work. I'm not, but my sense would be that it would depend on your agreements, your policies, or your protocols, guidelines. But also I would be thinking about maybe a flexible job for that person. So if they maybe have to take some time off, they might be able to make up those hours because of the flexibility of the job. So therefore, it's not going to impact on the employer, through every month there's a couple of days that person has to have off. Does anybody else have any thoughts about that question? Does that help, Tanya?
Yeah, hi, thanks, Anne. I mean, I guess she's looking for something a bit more permanent in the long term, and that this issue is not going to probably go away for some time. So yeah, it was an interesting one, and one of our colleagues suggested getting the fit for work, so that you've got something that you could hang your hat on, I suppose. But I could see it applying for anyone that has quite severe anxiety as well, or that type of thing.
I feel like last week we talked about you know, it would be good for that person to be able to feel open about the health issue that they might have, whether it's mental health or physical health, but also show that they are quite flexible and willing to adapt. Okay, so yes, if I do have maybe a panic attack or I have to take half a day off, you know, I'm happy to make that up, or you know, maybe they can work from home, with just some arrangements around that, because I can understand from employers and being a manager in the past, if you've got someone regularly taking time off, it's challenging. You've got to, sometimes you have to replace them, other times it means work builds up and doesn't get done. But I don't have the magic wand, and I think in terms of your agencies, what you know, what is written about, I'm sure you have agreements with employers that there must be stuff that's written about whether that disclosure has to occur. Does anybody else, can anybody else speak of their experience?
Yeah, we don't, a lot of our clients, we don't work so much directly with employers. So they are, you know, going off, they're applying for jobs off their own bat. And so, yeah, it's.
Yeah, okay, yeah.
Yeah, and look, some employers will just go, you know what, that just sounds too difficult and don't want to deal with someone else's issues. And
yeah,
and yeah, and they, yeah, this lady was quite worried that if she did say something, they would just, yeah, not even bother going any further with her application. So, yeah.
Yeah. And I guess I'm thinking with this more, you know, disability employment service, so people that, you know, with this disclosing and stuff like that, if someone's willing to employ someone who has some sort of, you know, bit of a mental health problem or some sort of disability, then you would expect that they would be more empathic about that, because they're putting on someone that they know has. So I think, you know, probably thinking more about that, whereas I guess a lot of you have people who, yeah, you might just help with a few different things that might not necessarily mean you're talking to an employer. So, yeah, all right. So what we'll do, did anybody else have a case study they wanted to, or just a case that they wanted to talk about? I'm doubting it because I haven't heard anything. But thanks, Tanya, for that question. And it's a bit of a hard one, I think. And yeah, I think you've just got to do your very best to be as supportive as you can and helpful, and, you know, get advice on those decisions from people who are, you know, perhaps more in the know. So, okay. So, all right. So have you got your case? I'm hoping you've got your case studies there. So we're going to look at James, and what we're going to do is break you into groups to just have a bit of a discussion about what you might think is happening with James, how you as an employee consultant, or even just as a person. Okay, so this can be helpful in any part of your life, really. But yeah, coming from your employment perspective as well. And what sort of things do you think might be helpful for him at the moment? So if you think about the different anxieties we talked about, it'd be good for you to see if you could pick what you think might be going on for him. All right. So James is a 21-year-old client of yours. 6 weeks ago, he was involved in a car accident. It was not his fault, but he does blame himself for it. An occupant of the other car was injured, though not severely. So James hasn't been able to drive a car since this, and he doesn't even feel comfortable travelling in a car. He works in a call centre and has become irritable at work, jumps at the slightest sound, and has been argumentative with some of his colleagues. He's also not sleeping well and admits to his supervisor that he's been drinking some nights to help himself fall asleep. All right, so Britt's going to break you up into groups, and we're just going to give it 5 minutes just to have a bit of a chat. And I want someone to be the spokesperson that's actually going to talk about what ideas you've come up with, because you've all probably got a lot of experience anyway that you can actually bring to this. There's no silly suggestions at all. So yeah, so Britt, if you're ready to do that, that would be really good.
No worries. I'll just pop you all into groups now. And I can move you into the groups if you want to pop in.
Can you just keep an eye on them and just see if they're chatting?
Okay.
Can you, yeah, that'll be good.
Hub.
And I am all the way up in the Northern Territory in Darwin, where a DES provider called Darwin Skills Development.
Right.
Wow.
Wow. all over the place.
Yeah.
Okay. How do we go? Just wondering if I could have one of the spokespeople talk about what they think might be happening with James.
I'll go. Our group basically just obviously is still reliving the accident, so he needs to have a chat to him about suggesting counselling or something to help him to get through that. And then,
hello, I'm not sure. Oh,
yeah, all good.
I missed that last bit. So we need to get him to get some counselling. What was the other thing? Sorry, Teresa.
Oh, I think it's just once you actually get him through and get that counselling process starting, I think that'll slowly, as long as it works, it'll slowly resolve a lot of those issues as far as his sleeping and drinking and everything's concerned.
Yeah, terrific. Yeah. And the other group? What were your thoughts about? What was your thoughts about what might be happening? Oh, I can't hear you, Margaret. You're muted. Could you? Oh, sorry about. Can you start again, please? Thank you.
Okay. We were talking about James and the fact that he is still employed. So maybe talking to his employer to see how he can get some support with his psychologist or counselor to deal with the psychological impact that has impacted him, and for him to come to terms with the fact that things like that do happen, and not to blame himself for the accident or what's happened to the other occupant. If the company has got a counselor internally or some sort of service that will provide that, then that would help. If not, we will support him by finding another one. That could help with his sleep and how he, has come to terms with the sudden impact of all this, which is only 6 weeks ago. Then also approaching it with the employer to discuss whether he could get some time off. To deal with how he's dealing with it mentally, psychologically, and so forth. At that same time, when the employer might be able to be a bit more empathetic about the whole situation and understand the circumstances.
Very good. I think you've answered all the questions there.
Thank you.
Excellent. Was there any other from the other group? Teresa, was there anything else with the other two questions, or do you think you've sort of covered that off as well?
Similar sort of things. Really just reassuring the employer that it's going to be a short term, once the counselling and everything kicks in, just to make sure that the supervisor's there and supportive. Maybe looking at, helping him build his confidence with his driving, like getting lifts to work with another employee, doing a safe driving course. Just things like that. Yeah,
fabulous. There's some fantastic suggestions. I've just got a couple to add. So just remembering this is possibly a bit of PTSD. It could be, it might not be. And what we talk about with PTSD is that if it goes on for more than a few weeks, so he might have that happen for a couple of weeks and then he works through it. But if it keeps going, that's when we know it really does need to be addressed. And so going to your GP, getting your psychology, whether it's using EAP or a mental health plan, is really important. Focusing on his poor function and the degree to which it's distressing him. So what is most distressing to you and how can we help? So those suggestions about he might need a little bit of time off, and those other sort of supportive things. So yeah, the professional help, of course, would be the GP and the counselling. And really with the alcohol, you might, if he talks about that, you might want to just explain to him in a very non-judgmental manner that it's probably not helping with him to be drinking, and that it can actually, be the cause of his poor quality sleep. So just a couple of extra things. So well done. So what I thought we might do, because it is 20 past, I'm going to move on to the last few slides. If we've got time, we'll come back to the next scenario. Although what we could do is just with Karen, she's helped. Right. Yeah. So so Karen's a person in a part-time job doing administrative duties in a small organisation of around 50 people. The first 4 weeks seem to be going quite well, but after this, you talk to Karen's manager, who says that Karen has a lot of absences due to vague physical symptoms and sees doctors quite frequently. She goes home from work often early, as well as citing stomach pains, headaches, and she sleeps poorly. As a result, propping herself up with caffeine during the day. And Karen's manager states that she tends to take a long time to do the jobs that she does, as well as often making list after list of tasks, but not managing to complete them. So Karen becomes flustered when asked about tasks she hasn't completed yet. So this sounds like a generalised anxiety disorder. And only because we're a bit short of time, because I really think the agencies and getting help is really important. It might be, it sounds like she has an anxiety disorder. Finding somewhere to talk quietly and privately about her absences and the fact that, her work is declining, and what are the symptoms. Not trying to convince her that there's nothing wrong with her. It's not, there's nothing medically wrong, like, that sort of thing. And try, maybe suggesting that she discusses anxiety with her doctor next time. And if you're in a position to go with her to the doctor, even better, because maybe she is not able to really pinpoint that this is anxiety. And sometimes doctors don't always pick it up either. You could give her some fact sheets about anxiety disorders. There's lots of them on, Beyond Blue and websites like that. And she's obviously going to need some counselling as well. She might need some medication too, but that's not, we're handing that over. That would be something for her GP to be looking at, or if she even has a special, goes to a specialist. So, and just your natural things like, getting plenty of rest and exercise, going for a massage, doing a bit of self-care, and maybe reducing her caffeine. So even though I would have loved to have done that as a group, I think, I just wanted to make sure we don't run out of time here. Is there any questions there with that scenario? Sorry. And that would be quite a common one, I'd imagine too, and can go unnoticed, to be blamed on being lazy or just being irritable, or, all the things that people that don't understand anxiety may not pick up on. So it's just good to be aware, these aches and pains and, that sort of stuff. Okay. All right, so I've just listed here, you've got your GP, we've got psychiatrists, psychologists, counsellors or school counsellors, mental health nurses, allied health professionals, youth workers and caseworkers. So GPs, we all pretty much know what they do. They do, well, it says offer brief talk therapies. They don't really have time for that, but some doctors have a special interest and might actually. They're able to prescribe, and they do a lot of referring. So they're kind of like the gateway to services. So the GPs are really useful. The quality of the GP, well, that's a different question. So if you know of good GPs around the place, it might be worth, if you've got clients that you don't think are getting far with their GP, maybe recommending, good GPs. Of course, they're medical doctors. And you know what to do here. Yeah, this is... and mostly covered by Medicare. Sometimes there's a gap, and you can often find, like in community health services, that it is actually bulk billed, so people don't have to worry, because often money is a concern for people. So psychiatrists, Okay, so these are doctors, obviously, with 6 years training after they've finished their medical degree. Several offer talk therapy, so counselling, but their main focus often is diagnosis and prescribing of medications, or making recommendations to GPs, perhaps maybe you should try this medication, or, you know, yeah, just giving secondary consultation and things like that. So you can access one through a referral from a GP, or you can just, like, people can just ring up and book in to see one, but they may have to, you know, pay the whole lot. So what a lot of people don't understand is that you can organise, and this could be handy for anyone, whether it's a family member or, you know, anybody, is that you can get a free appointment under an item number 291 with a psychiatrist through a referral from your GP, and it's free. And so there's a one-off consultation that can be paid for. Other than that, there would be a gap to pay for whatever person needs to regularly, perhaps a psychiatrist. There is also a telehealth program now, which is really easy to access, and it's called Call to Mind. There's another one called Constitute. And what happens is the GP just faxes off really brief, you know, really easy. If anyone wants the details of it, please feel free. I can send it, or you just look up Call to Mind. The GP just writes down, you know, just a couple of concerns, faxes it off. The practice manager will ring the person who needs the appointment and organise that. How are we going to do it? Is it going to be, you know, FaceTime or Zoom or whatever? They set up a time, the appointment happens, and then the psychiatrist writes quite a comprehensive report back to the GP. That's a really good way of having someone diagnosed and having getting, you know, some help for a GP and the person as well. All right, so yeah, with the mental health plan, it's mostly covered by Medicare. And so if people present to hospital or in a public hospital, they'll get all that for free. Psychologists, as we know, they have a 6-year degree usually. Clinical psychologists have tend to have a lot more training. They're more able to diagnose and that sort of thing. But there's different types. There's counselling psychologists as well as clinical psychologists. They all offer the talk therapies. As most of you would know, you probably all know that you can get a mental health plan through a GP to get not free appointments, but what happens is it covers a certain amount, and there may be a gap depending on what that psychologist charges. So they might end up, I can't remember the exact amount, I think it covers $110 or $120. So if they charge $160, there'll be that $40 gap. But it's a good one. You can get up to 20 appointments now. So that is a really useful, and there's a lot of ways of doing it now through telehealth, and which has been really good, particularly for rural areas, which I know a few of you are in. You know, when they don't have transport, they can't get, you know, they don't want to drive 2 or 3 hours just to go and, you know, when they could do perfectly fine and save a lot of time and money on, being able to do it if they're comfortable enough to do it through telehealth. As you can just ring up and book and pay the full cost as well. So counsellors, there's a few different types of counsellors. We need to be careful here. Counsellors aren't mandated. They're not they don't have a peak body kind of like, they don't have a peak body organisation like, so APRA is a peak body for nurses and psychologists, doctors, all sorts of things. Counsellors can go and do some study. They can do even not necessarily an undergraduate degree. They can actually do a diploma of counselling, and they can then open up their own private practice. So we always say to people that it's best to check out, try and get information about, not saying there's not really good counsellors around, but I think if they don't have if they're not a psychologist, it's worth checking them out to make sure what their qualifications are, what their experience is. And they normally they charge a certain amount, and I think you pretty much, unless it's through a community health centre, you have to pay for that. But yeah, I know a lot of community health centres have generalist counsellors, drug and alcohol counsellors, and that's all a free service too. So how do you access them? As I said, making an appointment directly through schools, sometimes if they're younger people, but that's probably not pertinent to you guys. And yeah, that's just talking about the costs there. All right. So mental health nurses work in often work in GP practices, and they do some counselling, and they sort of support the GP with more of the talk therapies and liaising between the person and the GP. Of course, you've got allied health, you know, your counsellors, your speech therapy, occupational therapy, those sorts of people, and youth and case workers. So there's lots of different types of case workers, case managers. A lot of them got different names, care coordinators, but often responsible for helping coordinate services for someone, supporting someone. So mental health services do have organisations around. In Victoria, there's Mind, there's Wellways, there's a few different ones, and a person can be referred to them for some support. And it might be, you know, around taking them, helping if they've got anxiety, helping them to do their shopping, or helping them with a particular goal. So they're very goal orientated. And case managers in mental health services, they tend to make sure that person, you know, look holistically at that person. Do they need housing? Do they need help with their finances? Of course, their mental health problems as well. But if your mental health problem might be recovering, but you don't have a house to live in, you don't have any income, then that's going to impact on your mental health. So making sure people are, you know, have a home, have somewhere to live, have an income, preferably a job, because that's so good for people. But yeah, coordinating all the services, because it gets very confusing trying to navigate all the services that people are using, especially complex clients who have lots of services. I don't know when the government will get it completely right, because I've always got the dream of the one-stop shop, the one-stop hub, you know, where all your allied health and counsellors and casework, you know, or employment, finance are all together. I think that I'm a bit of an idealist, but that's what I'd like to see. Yeah, so that's the services. The other one I haven't mentioned here, which I don't know why I didn't. So public mental health services, if you look up your own public mental health services, if you've got, because they're by catchment areas. So we are Gippsland, for example. So we have one phone number that anyone can ring into any time. Now, if you have a problem with, you're having concerns with a client, you're not sure what to do, not sure where to go, you can ring 24/7. There's always someone there. Sometimes you might have to leave a message, but you'll always be rung back. And just talk to the clinician, because they're trained clinicians, about, you know, I'm not sure, this is what's happening with this person. And, you know, they might be able to give you the names of other services if they don't actually fit into the public mental health service. Because the public mental health service is very much the pointy end of the scale. So you've got like very severe psychosis, depression, anxiety, severe anxiety, alcohol, you know, people that have psychosis through alcohol and drugs, people who may not have a diagnosed mental illness but are suicidal for some reason. Something's happened in their life. It could be loss of relationship or loved one or something, and they've become suicidal. So kind of very what we call low prevalence disorders, which is, yeah, your anxiety, psychosis, that sort of thing, and high prevalence disorders are, say, mild to moderate depression, mild to moderate anxiety, which can be managed in the primary health sector. But when someone's extremely depressed or extremely anxious or OCD, severe PTSD, they will usually be referred to a public mental health service, because there's a lot of you've got psychiatrists and a lot of infrastructure there to help that person. But you can't take everybody. So the idea of triage is to screen out who needs to come into the service and who doesn't need to come to the service, but always try and suggest and offer where that person might be, might fit. Like there's a new service, I don't know if you have heard of it, called Head to Help, which is a 1-800 or 1300 number where people can ring up with, you know, and refer. Anyone can refer, and they can access a whole lot of treatment through this program. And there's some walk-in, like we've got 2 walk-in clinics across Gippsland, and I'm pretty sure that it's a national initiative, and it was developed post-COVID. So, all right. I think that's about all, and the timing's not too bad. So the other thing I really want to point out is self-care is so important. So making sure that you're looking after yourself. I'm sure that sometimes your jobs can get quite stressful. And if you're wanting to help other people, it's really hard to help them if you're not helping yourself. And if you think about when you get into an aeroplane and they say, you know, put your mask on first, because if you can't breathe properly, then, you know, you're not going to help anybody else. So, yeah, looking after yourself is a really big thing. All right. So do we have any questions? Comments?
And that public mental health service, is that in your list of recommendable, that directory that you sent out, or?
I didn't put it in because I'm in Gippsland, but a lot of you, I'm thinking most of you aren't. So what I was thinking with that part, if you just look up mental health, area mental health service, if you Google it, you'll find out where your catchment area is, and then you can get that triage number for that area. Okay. Yeah.
I was looking at private mental health, and it didn't sort of, is it the health under the Health Victoria government site, or
it should be, yeah, because it's public. Yeah. What were you saying about private? Sorry, Tanya.
Oh, I thought you said, you know, if you did a search for the private mental health services, you'd have that sort of central number or something. But
no, not private. No, you put yeah, you just put mental health triage, you know, whatever town you're in, and something should come up. Or, you know, do most of you know what your catchment area is called? Like we're Gippsland, for example. You've got southwest and northeast, and you know those sorts of things. So it's really just a matter of finding what your local one is, and it is a really valuable resource because, as I said, you'll get the advice, hopefully really good advice, and don't, you know, there's no reason why you can't ring. If you want to refer someone, that you do need to have their permission unless they're high risk, and high risk, but it's duty of care that something happens and that's responded to. Yeah, so just if they're a bit apprehensive about it, but you feel they really need the service, you can ring up, you can actually refer for them too.
Yeah. No, got that, thanks.
Mm-hmm. All right, well, thanks everybody for participating, and I hope it's been helpful for you. We will be sending out some evaluations, and maybe you might like to, I'm very happy for you to give feedback of how you'd like it run, or if you think, you know, any suggestions of how it might run differently, or if you like the way it was. Also, any other topics around the mental health, you know, in the mental health area that you might like to have some more education on. Very happy to look at further education in the future. Okay. All right. Bye, everyone.
Thank you, Anne. Ta. Bye.
Thank you.
No worries. Oh, hang on.